everyone, so today me and my group are going to present one of the red blood cell abnormalities, which is acanthocyte. So for the topic outline, all of my group member will be explain all about the introduction, the morphology, the causes and the symptom of the related disease, the diagnosis and how to treat them. Acanthocyte, also called as spur cell, with irregular, pointed, club-like projection that are unevenly distributed on the surface of the cell. They are like a star shape. They have like very pointed at the edges of the cell. As you can see from the image, you can compare between the normal and the acanthocyte one. Also, acanthocyte form as a result of membrane lipid abnormalities, and it can be seen in liver disease, neuroacanthocytosis, which is a movement disorder, severe malnutrition, and abetalipoproteinemia, which is it has a low level of cholesterol, low level of plasma, low level of LDL, and low level of VLDL.
So, what can trigger acanthocytosis? Our blood cell has the membrane layers that consist of fat and protein. When the level of the fat and protein is disturbed, this is where acanthocytosis can occur. Some factors that can lead to acanthocytosis is when a person is having a syndrome where its body couldn't digest fat and essential vitamin called Benson-Brunswick syndrome. Next is splenectomy. When the spleen is removed, it can provoke the morphological changes in the RBC and cause hemolytic anemia. If someone is suffering from acanthocytosis, it may give the symptom of excreting a dark urine, too much bilirubin in bloodstream that can cause jaundice, microglial problem that leads to memory loss and confusion, and muscle spasms such as jerky movement.
So I will continue with the difference between normal and abnormal RBC. So as you can see at the right side, it shows the normal RBC, which is have a biconcave shape, while the other side it shows the abnormal RBC, which is have acanthocyte RBC. The formation of acanthocyte is either hereditary or acquired membrane defect, which is imbalance between the membrane cholesterol and lipid content. So firstly, it caused by abnormalities of the outer leaflet of the bilayer, which lead to acanthocytic disorder, and then formation caused by decrease of polyunsaturated with saturated and monounsaturated fatty acid, which occur in cirrhosis patient, and also increase in proteolytic activity in RBC. The morphology of acanthocyte, we call it a spur red blood cell. It have variable size of creation, have a big size and small size. Can refer to the photo, which is it shows the big and small size. Next, dense and shrunken with compact and smaller RBC. Next, lacking an area of central pallor. The circle area in a red blood cell, which is normal red blood cell, have central pallor, wide at the middle, but for acanthocyte, it has a star-like spike on the outside, which pointed and club-like projection on the cell surface, and also star-pointed shape. Okay, I will pass to the next person.
Diagnosis of acanthocytes. The main diagnosis that can be done is the peripheral blood smear, which the doctor will detect any morphology of acanthocytes under the microscope. The image shown here is a blood smear of a patient with acanthocytosis. We can see there is a spiky appearance of red blood cell. Next is the complete blood count. For complete blood count, the doctor will check any complications associated with acanthocytosis, such as anemia. And if there's a neural involvement with the acanthocytosis, the doctor also can order for MRI, CT scan or EEG to check the brain condition.
So I'll be explaining about the treatment and the conclusion for this presentation. So the treatment depends on the cause. There are three main causes, which is anorexia, known as eating disorder, hemolytic anemia, which is known as severe liver disease, and also abetalipoproteinemia, which is based on supplement or diets. So for the first one is anorexia or malnutrition. The treatment we could see is stabilizing weight loss, or we can also go for psychotherapy or medication, and also for nutrition counselor. We can seek any counselor based on nutrition. So for the next liver disease, we can do blood transfusion plus plasmapheresis, which is known as clean our blood, and liver transplant, and also shunt bypasses our liver, known as TIP as tips. And for the third is supplement or diet. we could intake the vitamin A, D, E, K, and X. So next we will be going to the conclusion part. For the conclusion part, acanthocytosis is rare, finding the presence of irregularly shaped red blood cells with pointed projections on their surface. And also treatment for acanthocytosis depends on the condition causing it, and blood transfusions may be necessary if the acanthocytosis is severe and causes symptoms such as anemia or fatigue. Acanthocytosis is typically detected during routine blood tests. It is important to note that acanthocytosis is not typically used as a standalone diagnostics marker, and that its presence should be considered in the context of the patient's overall clinic picture. So that's all from me. Thank you.